All right, it's all about the numbers. Good evening, everybody, and thank you so much for staying with us on this Tuesday at 5:30. I'm Darlene Hill.
And I'm Brad Johansson. Well, for doctors, scientists dealing with COVID-19, it's a process of trying to unveil the unknown. But for Dr. Douglas Frank and his students at Schilling Gifted School in Ohio, this is a data project. It's all about the numbers. And according to the numbers, coronavirus has run its course in Ohio. And he says it's time to reopen the Buckeye State, while local leaders say not so fast. COVID has run its course in Ohio, except for a couple of places.
Yeah, it's like a forest fire. It's already come through and the major fire's over, but now there are a few breakouts. And, you know, it's always like that when you hear a fire report. You know, they'll say the fire is 90% contained or something like that, and there are a few little breakouts, and they're working on those spots. It's kind of like that.
I would disagree that the forest fire ran through. I think what we experienced in late April and May was mild compared to what we're experiencing now.
Frank has a student with family near Wuhan, China, the source of the coronavirus outbreak. So his math class decided back in December to study the spread. So what number tells you where we are in this pandemic?
The number of deaths is the best, most reliable way to know. The number of deaths per day.
The most reliable way, he says, since his study began 9 months ago to track this virus. But still the number of lives lost, like all of the daily numbers reported, lag. For example, on Tuesday, August 11th, the number of deaths reported over the previous 24 hours by the governor was 35. In actuality, 35 is the number of death certificates that came in that day, and only later is the actual date of death assigned. So by Wednesday the 12th, only one person is officially listed as dying from COVID the day before, and that number could change over the next 2 weeks as the data catches up.
One of my controls was I'm not allowed to listen to any news, any media. I'm only allowed to gather data. That way I'm completely objective.
Dr. Frank now tracks the virus across the country and around the world, presenting his daily findings on his analytics Facebook page. He's convinced that Ohio's pop-up and free-for-all testing isn't providing a clear picture.
If you test 100 people every day and you do it the same way every day and you get a certain percentage and you're tracking that, okay, that's a nice consistent thing to do. But we're not doing the same amount every day, and we are using a test that's not designed to identify COVID patients, where it's designed to detect certain proteins and certain antibodies.
Roberts contends the quick antigen test, for which Governor DeWine tested positive, does have drawbacks, but not the test being used for the public in Ohio.
The PCR test, which is really the gold standard of testing and what's been done over the majority of the state of Ohio, is a great test, and it's very indicative of telling us who has COVID-19.
Still, Frank says the counting includes those without symptoms, those who may have had the virus and are still carrying DNA that produces positives. Roberts acknowledges by the numbers, Ohio is moving in a positive direction.
I'm here today to tell you that we've seen 3 consecutive weeks of a downward trend.
That trend, Frank says, is tied directly to the amount of testing done over those 3 weeks. 4 weeks ago, Ohio was testing 25,000 people per week. Due to supplies, that has dropped to about 22,000 per week, a 12% decrease, which coincides exactly with the 3-week downward trend of cases. But the 4th week didn't produce a downward trend that Roberts was looking for, which takes us to now.
If this 5th week continues as a drop, would you be confident in opening schools?
If epidemiologically it's statistically significant, yes, my recommendation would be that schools can resume face-to-face education.
In elementary school, those kids, they're safe. They're relatively safe.
So you would open schools?
Oh, in a second. They're safe.
Everywhere across Ohio?
Oh, yeah.
Roberts says the data on that is changing as they find that kids over 10 may asymptomatically spread it more, and in classrooms with kids and teachers can further spread if protocols aren't followed.
People are being exposed to each other, and when people are exposed to each other, we're going to share the virus. The virus is going to be with us for a while.
Frank is a numbers don't lie professor. The problem is the numbers don't come immediately. So for those making decisions, definitive answers can't be immediate.
So I fully expect next flu season for us to have more COVID. But like I gave with the example of the forest fire, once you've gone through and cleaned it up once, it's hard to start another fire there the next year.
Flu pandemic that happened in 1918 lasted 2 years. So keep that in mind. We're only 5-6 months into this, and it could be another 18 months before we're really over the hill.
And as far as the vaccine goes, Frank says that having an effective vaccine ready in months is unrealistic. And Robert says we have to adjust to the virus because this virus is not going to adjust to us. Page on our website, NBC4i.com. Just click on the story there. So Frank even says that the published data that the Ohio has put out would indicate that there has been a steady drop. This is a good sign for Ohio. He feels good about kids in school. But once we talk about this, we're talking about the unknown again.
Right.
He's only dealing with the numbers. And remember, he hasn't listened to the media reports. Even when I talked to him, he said, I'm not even sure what Dr. Fauci looks like. I haven't done that because I just want it to be data.
It's interesting information, but again, I'll go back to what Lieutenant Governor John Husted said today, and he just said, you got to follow your own instincts. You got to follow what's going on and the numbers going on in your community right now because they're all different.